Health Minister Douglas Mumbeshora says the country has faced protracted cholera outbreak since February last year and claimed 452 lives with a case of fatality of 2.2%.
We are not proud of the performance that we have done so far because the 2.2% case fatality rate is still quite high. The acceptable should be zero, but WHO and UNICEF, you tell us that less than 1%. Why should we accept a death on something that can be prevented? So at 2.2%, I think we are not happy.
The country has also recorded a rate of infections of the waterborne disease in children, prompting UNICEF, the Health Resilience Fund, and other partners to step in and assist the country in the containment of the outbreak.
Amongst the reported cholera cases, 31% were under 15 years of age, while 14% were children under the age of 5. And as we can see today, most of the commodities that were received will cater for the children. So we hope that these are the vulnerable people, and these commodities will go a long way in reducing the mortality in children.
$265,000 worth of cholera medicines and commodities had been given to Zimbabwe just a couple of days before the country begins a nationwide cholera vaccination program.
When you're responding to an outbreak, the issue is the speed that you respond, because you want to be faster than the rate at which the cholera is spreading. So that's the impact that we're looking at. I wish I could give you a specific answer in terms of gaps, but working with our partners is something which the coordination mechanisms are still working around in terms of determining. But in any case, while you can determine the gap that's there today, because of the speed at which the outbreak is spreading, tomorrow it will be a change story altogether, but we're trying to catch up.
We are convinced that with the trajectory that we are seeing and the commitment leading to the oral cholera vaccination, but also the hard work of parents, communities and health workers, we might begin to start seeing the light at the end of the tunnel. And UNICEF is very grateful to our donors and partners, but more importantly, the leadership of the Ministry of Health in this fight towards eliminating cholera in Zimbabwe.
On Monday, Zimbabwe will commence the initial phase of oral cholera vaccination to administer 892,000 doses by the 2nd of February. Khumalo, SABC News.